The VivaSight DL is a single-use left-sided double-lumen cuffed PVC endobronchial tube with an embedded camera and light source at the distal end of the tracheal lumen. The VivaSight SL is a single-use cuffed PVC endotracheal tube with an embedded camera and light source at the distal end of the tracheal lumen and an integrated single-use adapter cable with connector. VivaSight single lumen can also be used with a bronchial blocker for one-lung ventilation procedures. Both the VivaSight double and single lumen work with the Ambu AView monitor via the single-use adapter cable to offer uninterrupted visualization for precise tube placement and continuous airway monitoring throughout the entire procedure. Before intubation with VivaSight double lumen, suction out any secretions in the oral cavity and airway to avoid obscuring the lens. Additionally, a drying agent may be administered unless contraindicated. Select the correct size VivaSight for the intubation. Then connect the VivaSight to the AView monitor and obtain an image on the monitor following the instructions for use guidelines. Prepare the patient and lubricate the tube, avoiding the area around the camera lens. Add 1 to 2 drops of anti-fog to the camera lens. Confirm that the stylet is inserted into the bronchial lumen of the VivaSight DL. Then insert the VivaSight DL into the patient's oral cavity with the aid of the laryngoscope. Advance the VivaSight DL bronchial tube towards the vocal cords, with the tip facing upward, such that the bronchial lumen of the tube is positioned above the tracheal lumen. When the tip passes through the vocal cords and before the camera passes it, remove the stylet and then turn the tube 90 degrees counterclockwise so the tip is facing to the left and the camera is at the 12 o'clock position. Advance the tube slowly until the tube is positioned inside the trachea and inserted into the left main bronchus. The proximal section of the bronchial arm should be on the left side. Use the camera of the VivaSight to confirm tube positioning. Then inflate the tracheal and bronchial cuffs in normal fashion. The VivaSight DL comes with a Y connector to aid in ventilation. When assembling, make sure to connect the blue tube of the Y connector to the bronchial tube of the VivaSight DL and the clear tube of the Y connector to the tracheal tube of the VivaSight DL. The Y connector has an arrow printed on both the tracheal and the bronchial lumens indicating the flow of air, and identical arrows are printed on the rotator connected to each of the 2 lumens. The rotators are moved to either open or close their respective lumens. When a rotator is in a position where its arrow is pointing in the same direction as the arrow on the corresponding lumen, the lumen is open for ventilation. If the arrow on the rotator is facing away from the lumen arrow, the lumen is closed. Two types of suction catheters are provided with the VivaSight DL to assist with secretion management. These are the VivaSight suction catheter straight 8 French and curved 10 French. If during the intubation process secretions begin to obstruct the view of the camera, first attempt to clean the camera by injecting 2 to 4 cc of saline and air through the flush port, following the recommended cleaning method in the IFU. If that does not work, use the provided suction catheters to suction off the secretions by placing either suction catheter down the tracheal lumen and following the instructions in the IFU. Before intubation with VivaSight SL, suction out secretions in the oral cavity and airway to avoid obscuring the lens. Additionally, a drying agent may be administered unless contraindicated. Select the appropriate size VivaSight SL for intubation. Then connect the VivaSight to the AView monitor and obtain an image on the AView monitor following the instructions for use for the AView monitor. Prepare the patient, lubricate the tube avoiding the camera lens, and apply 2 to 3 drops of anti-fog to the camera. Then, using a laryngoscope to visualize the vocal cords, intubate according to currently accepted medical techniques. Once the tip of the tube is past the vocal cords, The video on the A view from the VivaSight camera can be used to guide the tube down the trachea. The final tube position should be inside the trachea 3 to 4 centimeters above the main carina, and the tracheal cuff should be inflated. Once the VivaSight SL is in place, insert an endobronchial blocker through the VivaSight SL. Then manipulate the blocker toward the main stem bronchus you wish to occlude, while visualizing insertion with the camera on the VivaSight SL. Once the blocker is in the correct bronchus, inflate the balloon and confirm placement with the VivaSight SL camera. After procedures with the VivaSight DL or SL, deflate the cuffs completely as per protocol, and extubate slowly while examining the airway on the AView monitor one last time. Disconnect the single-use adapter cable from the AView monitor and turn it off. Discard the single-use VivaSight DL or SL tube, stylet, Y connector, adapter cable, and suction catheters in a suitable biohazard receptacle in accordance with local regulations.